Hello, everyone. Thanks for joining us a little bit. Sorry, we're a little late this afternoon for our media briefing. Thanks very much for joining us. We appreciate you all being here. And we're going to get started with our briefing with Charles McKee, our CAO, who will lead us off today at 1 o'clock. Hi, Charles.
Thank you, May. I appreciate that. And as usual, I appreciate the media joining us as we do these 3 days a week. As you know, we try to schedule different participants to join each one of these media briefings, and they each have some information that we think can be useful to the media Monday, Wednesdays, and Fridays. But it's a tentative schedule, I think, as May has tried to articulate that there are other matters that people are working on that may prevent them from attending these, or they might have other commitments that take them away from the ability to join each one of these media briefings. So if there's somebody that's not on that you wish was on, we can try to get them for the next briefing and just let us know, but recognize that the schedule is the participant panel is a tentative panel. So just appreciate everybody's bearing with us on that as we kind of work through all the issues that we have with this new pandemic. I wanted to recognize that obviously the news of the day is the new health order issued by Dr. Moreno, the new shelter-in-place order with a lot of significant easing of restrictions. What should be kept in mind is that we're looking at this as a strategy, as a package, as part of our overall attempt to contain the virus. The community of Monterey County has done a remarkable job in keeping the virus at low numbers here as far as we know from testing, but we also know that testing overall has been limited to those persons who are showing the appropriate symptoms to qualify for testing. So the strategy is multi-pronged, and it's a package. And one of the big issues was what we talked about yesterday, or released yesterday, was information about additional testing sites here in Monterey County, and that goes along with the facial covering order that Dr. Moreno issued earlier in the week that we think is the package, and this is the next leg of the package, which is a new order that would go into effect on Monday, which eases many of the restrictions. Of course, that we don't want to reverse course and have our numbers shoot up. We don't want to have to reimpose any restrictions. We want to keep easing restrictions. So the better compliance we get with the making sure that people are following good protocols with face masking, with washing of hands, with face coverings, washing of hands, and we can increase the testing along with good physical distancing. We're going to be able to continue to have easing of those restrictions. We can see evidence from some of our neighboring counties who didn't take measures as early as we did, and their numbers are far higher than ours. And some of those counties have populations that are in lower numbers than us, and yet their reported positive case numbers are much higher than ours, and some of their hospitalization rates are much higher than ours. And you can see that throughout the world too, where there are places that just didn't do the shelter-in-place orders early, and unfortunately they're paying for it. There are also other areas that seem to have been luckily spared in many ways, and we want to learn from the positives that they have accomplished in their communities. I don't want to, say that any other county is doing it necessarily wrong, but you can look at some of the places where they have significantly higher numbers than us, and recognize that we don't want to be there, and we want to keep having our numbers low. And the more that we keep our numbers low, the more likely we're going to be able to follow the guidelines that the state has set out to gradually reopen Monterey County. We have new order, as I said, and those industries that are in the order that will have easing of restrictions. I'm sure there's a lot of relief there. There's going to be a lot of relief across the county, and there are going to be many industries and individual businesses that are going to come forward and show that they can be included in that, in those easing of restrictions. And we're going to look at those as we have a gradual reopening of the county. I think the message is that we're gonna work hard to keep this virus at bay, but we also recognize that it's a long haul, and there will be a lot to address as we until we get the vaccine, until we get the numbers low where we feel comfortable going out of the community, with lesser restrictions on our mobility, on our ability to interact with each other, and just have our daily life back to normal. It's all what we want, and we hope to get there soon. So with that, Maya, I will turn it over to you.
Thank you very much, Charles. And now joining us is Dr. Ed Moreno, our health officer for the county, and he'll talk a little bit more about the new revised order that was released this morning. And then after that, we'll take your questions. Hi, Dr. Moreno. If you could unmute, that would be great.
Thanks. I won't repeat what Charles has said, but I agree. There's several actions that are happening simultaneously. The significant increase for us compared to what we have now in testing, and and as we release some restrictions, and more people are leaving their homes to participate in those activities. The face covering is going to be really important, because as fewer people stay home and more people leave their homes, every time they leave their homes, they're running a risk of getting exposed. And so the face coverings will help us protect each other from getting infected. So the current health officer shelter in place order, which expires on the 3rd, is one in which we looked at essential activities. Was the minimum that we need to do, and while we are looking to see what this virus is doing in our community and other communities, and then we start collecting data as we get more confirmed cases, and we look at hospitalizations and ICU stays. So what we have here in Monterey County is a situation where rather than the number of cases doubling every 6 days, now we have the number of total cases doubling every 14 days, excuse me. And so that means, and fortunately we've been that way for the duration of this last order. And so that tells me that there are more cases. I mean, the number of cases are doubling, but it's taking longer for that number to double. And so our community, we've all done, I think, a really good job in staying home and leaving only when we really need to, and we do keep practicing social distancing. And now this face covering will help us even further. So now, as we move forward with this next order, the approach that many of us and local health officers and the governor as well are starting to make decisions on releasing some of the restrictions based on current data and risk analysis. So what we're looking at is trying to achieve maximum social and emotional and economic benefit while still maintaining a low transmission, or at least minimize the transmission, of the virus. And so we're also moving forward going to be looking at, and that was some of the criteria that I just explained in deciding which sectors to relax in this next order. Moving forward, also have to, or I've had several discussions with the state health officer and my health officer and health director colleagues about things that we're going to need to track over time in order to inform us as we move forward. We want to make sure that if we have further, with this new order, as I mentioned, people are going to get out and there are going to be more exposures, and so we will continue to see more cases. And so we want to monitor what's happening here in Monterey County. So we'll continue to collect, our health department continue to collect hospitalization rates for COVID-19, ICU rates for COVID-19, and confirmed cases. And also when we have a lot more testing of people who have little to no symptoms, we're also going to expect to see an increase in the number of cases throughout the state, because a lot of counties are getting this enhanced testing. And so we're going to have to have our best epidemiologists looking at the data and try to determine, if we can, what part of the increased number of confirmed cases is due to actually more rapid spread of the disease, and how much is due to just testing more people. So it's possible that if we didn't, if the rate of transmission didn't change, but we are testing a lot more people, or it look like the rate is increasing, and it may not be the case. So we'll have to have some good people working on this to continue to inform us on moving forward. We also want to make sure as we move forward, we're doing so in a manner in which if there is a rapid rise and rapid demand for hospital services, that we have the capacity in our hospitals to take in those individuals and hospitalize them. That depends on their ability to continue to staff, because if we get outbreaks of COVID-19 in a hospital, that could deplete the hospital workforce. So we have to continue to monitor that. The other thing we have to monitor is how many weeks of PPE supply our hospitals have, and if there was a surge, how long would that amount of PPE, how long would it last? And finally, we also have to look at, as we increase testing, making sure that we're not hoping, we're anticipating that we'll start to soon have serology testing to go to complement our data. The test that we're getting here in Monterey County is the test to actually determine whether someone is infected and infectious with COVID-19. And that guides us in continuing to isolate those individuals and inform people that were in close contact that they need to quarantine themselves so they don't expose someone else should they come down with symptoms. Serology testing is different. It basically just informs us as to what percentage of the population has been exposed to COVID-19. And then as we repeat that testing over time, we can see how fast that is rising. So the proportion of individuals at the beginning might be estimated to be maybe, as an example, 5% of people already been exposed. And then a week or two or a month later, we want to see what percent are now exposed. We expect it to go up, but how fast will it go up? And so that information is also going to be really helpful. And again, we're going to get our best, as a state, we'll have our best epidemiologists looking at that data and helping to interpret it to further guide where we can continue and how soon we can continue to release some of the restrictions. So I can go through some of the changes, Maya, in the order if you like.
Sure, go ahead.
Oops. Sorry, guys. So major changes are that in the area of construction, we have released the restrictions. Previously, we had only essential construction, and now we have released that. So the intent is to align the what's happening in the construction, the type of construction in Monterey County, with what the governor's has deemed as essential sectors. So that's one change. We also will be issuing safety protocols for construction that they will need to follow in order to protect their employees. And so because some construction occurs while people are still residing in their homes or when businesses are still operating, how are they to make sure that these safety protocols will require them to take measures to prevent interaction, potential exposure between the workers and the people who are still living or working in those locations. Another area that's new is on golf. So golf courses, golf ranges can now operate, and we're also issuing safety protocols for golf. And I just want to thank the industry consortium of golf facilities, golf owners, managers who came together to identify ways in which they can promote social distancing and also prevent contact and with surfaces that could transmit COVID-19. So that's been changed as well. Then we get into essential businesses and essential government. As far as essential businesses, continuous essential businesses, I apologize. We're looking at, as here in this part of the state, looking at ways to expand on childcare. And so the current requirements for childcare have not changed, and that is the requirements for cohorting kids, not more than 10 in a group, and kids can't move from one group to another. Instructors can't move from one group to another, are still in effect. And what we're looking at, though, is a possibility that in-class or some type of, to some degree, some in-class instruction might occur for schools this coming fall. What can we do this summer, if any, this summer? And many of us are and have included summer camps in the group of child care facilities. And those summer camps have to follow the same, are under the same requirements. So they have to cohort not more than 12 kids in a camp group, and instructors can't go between camp groups and the kids can't go between camp groups. So this will, issuing it now before summer allows our schools and allows organizations that have provided summer camps in the past to start, so we can start making plans and developing protocols that might be unique to their situation. So they'll have to follow this order, but there might be some additional measures they could take depending on the circumstances of the summer camp. So we're moving forward with planning for summer camps this summer. I also recognize that under government services, we have an ongoing need to train future first responders. And in the previous order, I had worked with the sheriff and a couple of police chiefs and the president of Monterey Peninsula College, as well as the owner of the company that provides the instruction, on trying to do what we can to prevent the spread of COVID-19 among our cadets. And so those in the academy. And so in the prior order, we suspended in classroom instruction for those students. That was aligned with suspending in classroom instruction in our schools and in our universities. Based on, again, looking at the rate at which confirmed COVID cases are increasing and our hospitalization rates being stable, that's an important part of government that we now can open up and we can resume courses again to continue to the instruction of our future first responders. So the sheriff was pleased with that. The university president was satisfied with the conditions, and we're moving forward with that. There's also in this order a recognition that I've placed a requirement countywide for people to cover their face. And so people need, some people are going to need supplies to create masks for themselves, create masks for their friends and family, and protect themselves and each other. So the order does allow for fabric stores, supply fabric, and the other material necessary to make face coverings to resume operations so that our Monterey County residents can take measures to make their own face coverings and for get face coverings for others as well. Let's see, I believe, Maya, those are the highlights.
All right, thank you, Dr. Moreno. And I know there are a lot of people with questions. So I'm going to start with questionings as they have come in order to me. I believe Elsa Jimenez, our Health Department Director, is on our call. I have the first question regarding the testing sites and whether we know what locations have been identified or what areas are being considered. Elsa, are you still on the call?
Hi, good afternoon. Can you hear me?
Yes, I can.
Hi, this is Elsa Jimenez, the Director of the Health Department. As indicated in our press release yesterday, we are going to be setting up these 2 testing sites in the city of Salinas and the city of Greenfield. We are still finalizing the details in terms of date time, start time. We're waiting to hear more information from the state regarding the phone number and the website that individuals will need to access to be able to register. And we hope to be able to hopefully finalize the details or tomorrow, and we'll work with Maya and Karen to put out a new press release that will have all of the information included. There is a question, I do see a question in there in terms of testing. Our understanding is that the governor's proposal with the 80 sites is to be able to increase our daily testing by 10,500. So that means that each testing site is slated to hopefully test up to 132 individuals per day.
Great. Thanks for catching that question and get it out of the way. Thank you. Next question, I think this goes back to Charles and possibly Dr. Moreno might be able to answer. Charles, you mentioned in your comments about counties with smaller populations who've acted more slowly on shelter-in-place orders, having larger COVID-19 numbers, including hospitalizations. Are you able to share more on that?
I just caught the end of that. Sorry, I was on another call and heard you say my name. So I think what you were asking is about the other jurisdictions that might have higher numbers. Is that what you said?
Yes.
Well, I know that. Well, I can give some. I know that, for example, I know Santa Barbara County has higher numbers by far. I know that there's several in the San Joaquin Valley that have higher numbers. Whether they're a similar size population, larger or smaller, they seem to have either higher overall or higher per person. And I think the Monterey County Weekly actually did a little story on that at one point, but I'm not sure they captured all the kind of information that's out there that shows that there are some jurisdictions obviously that are lower, but there are quite a few that are higher, even those that have similar sized populations or lower populations. So I just think it's something that we have to be careful that we're aware of how it's spreading in other jurisdictions as best we can and learn from them and see if there are ways that we can avoid having those kinds of increased numbers here, but also recognize that in many cases those other jurisdictions didn't necessarily take the same early precautions that we did.
Thank you, Charles. And here's a question for Dr. Moreno. What will you need to see before you completely lift the shelter in place? A vaccine? And should we assume there would be restrictions until a vaccine is available?
Oh, thank you. Yeah, that's part of my answer. So yeah, we need to, hold on a second. Okay, so we as a nation need to have a few things in place. I mentioned a few which are underway to allow us to ease up on some of the restrictions, and that is having bed capacity, having stable, having steady or stable cases or hospitalizations, and capacity for surge in both hospital beds and staffing and PPE. So those are a few things that we need to continue to build on, as well as collecting more data through serology testing. So in addition to that, what we're looking at is learning more about the virus. The virus has there are reports that the virus is mutating, and with mutations, usually with mutations in a situation like this, the mutations mutate to a version of virus that is less virulent, meaning it does that people aren't sick as long and they have fewer complications. But this is not a virus that we've seen do that. For example, with flu, this is not flu. This is something that continues to mutate in different, and we're still learning about it. So we have to have more information about this virus as well. We also need to have, as you mentioned, a vaccine, and not just any vaccine. We have to have a vaccine that actually imparts immunity. So we can give vaccines, and people can mount immune responses and develop antibodies to the vaccine, but we need to know that those antibodies will actually protect someone against the virus when they get exposed. We're also talking long term. We're also looking at what percentage of the population has immunity to COVID-19, not just have been exposed, not just antibodies or vaccine. What percentage are actually immune to the virus? So, with I'll give an example like I think hepatitis A. If you get hepatitis A, you're immune for the rest of your life. We know that. If you get a vaccine, you're pretty much protected from most, if not the rest of your life. We don't have any information. We don't have a vaccine, and so even if we get the vaccine, we're going to have to start, not me, but people a lot smarter than me, groups, universities, research are going to have to study this and determine what proportion of the population is actually immune to the virus, and what proportion, what's the threshold? Is it 50, 60, 70, 80% that's needed to allow more people, particularly people who are older than 65 and people with heart disease, lung disease, kidney disease, to spend more time out of their homes. So those are some of the long-term considerations for easing up restrictions as much as possible. But again, we don't know. We are still learning about this virus, and there may be a time when we are getting to a stable place where there's outbreaks here and there, and we'll have to decide whether or not we can completely go back to life the way it was, or whether we're going to have to continue to have some degree of social distancing to continue to protect ourselves.
Thank you, Dr. Moreno. And here is another question for you. How specifically does this revised order allow businesses the flexibility to reopen?
So the changes in the order are, I said there's two changes in the order that have safety protocols, and again, that's golf and construction. So that would provide really little flexibility, but the thing is, the construction can go on and golf can go on as long as they follow those restrictions. The additional, the other changes like the summer camps, that's going to require us to work closely with summer camp providers over the next few weeks. So some advanced planning to make sure that we can identify ways that they can, besides the social distancing requirements in the order, identify if there's anything in particular that's unique to them to make sure they're not unnecessarily exposing instructors or kids to COVID-19. And as far as the fabric stores, the restriction there is that they are to basically focus on providing materials necessary for Monterey County residents to mask, but they still have to follow all the social distancing requirements in the order, as well as the standalone face covering order to protect their workers and their employees.
Thank you, Dr. Moreno. Here's another question. What kind of a projected surge are you using to plan for and assess the current healthcare system's capacity to deal with COVID-19 impacts?
Sure. So there are several models developed by universities in the United States, and we chose, our epidemiologist and I chose the model out of University of Pennsylvania, CHIME, C-H-I-M-E, as it's also known. And we felt it, we picked that one because that one did extend the surge curve beyond the peak, and where some of them, the surge only went to about the peak and stopped. And it also, we felt best fit, our epidemiologist felt it best fit Monterey County. The first surge analysis that we conducted was shared with our hospitals so that they could see what a surge curve could look like for Monterey County. And the limitations of the results were shared with our hospitals, and they continued to, they use that and another information that, from the state of California to increase the number of patients that they could hospitalize in preparation for a surge. Moving forward, it's been a few weeks since we last did that, and we've had, I think we have doubled our number of cases. So our epidemiology team is now running that analysis again with the CHIME tool, and we hope, I'm told that very soon we'll have some information we can share with the hospitals, and that we expect might be more reliable, maybe more helpful. Because I don't know it's much of a right or wrong or reliable or not reliable. It's basically one tool they can use that may be helpful for them as they continue to prepare for a surge.
Thank you. And here's another question that's related to testing. Elsa spoke about the state testing sites that are coming in, but are we able to see more testing in Monterey County? And this may be in reference to the public health lab where you're getting more kits, as well as the 2 testing sites that we're going to see come in Monterey County.
Sure. So in terms of the, I'll provide some information about testing. So we've been at this testing now for at least a couple of months, and we have a total, excuse me, I might have spoke earlier in the day, Charles. We have a total of 3,000 tests in Monterey County already performed. The county health department is responsible for about 2,300, so about a third, a little over a third of the 73% to be exact of all the tests conducted in Monterey County. And we're looking at, and that was over a couple of months. And so we've slowly increased our capacity. Now every hospital has testing capacity. And so if those on the phone, on Zoom here get a chance to look at our, again, at our webpage, you'll see now that 11% of hospital laboratories are now, hospital laboratories are responsible for 11% of the total tests. And so that number is due to vendors fulfilling the hospital's orders for machines that run the test and the test supplies, and also the California Department of Public Health sending new test equipment and the test reagents to run the test to our hospitals as well. So our hospitals are getting tests, the equipment and the test kits. So they're all capable, I believe they're all capable now of running tests. So that enhances our public health lab and the commercial lab's ability to test as well. The benefit of the hospital's testing is that a patient can stay in the emergency room and wait for the test result. And so I think it's an important benefit that we have now in Monterey County. And our tests are still, will take about 24 hours to get the result back to the ordering physician. But our test has, what I'm told is our test has higher sensitivity and specificity. And that's because it takes hours for us to run our test. But when the test is positive, there's a very, very high likelihood that the person actually has COVID-19. And when the test is negative, very high likelihood that the person does not have COVID-19. So we're working with our hospitals on their testing, and they're developing protocols for themselves as to which type of patients they're going to use their new testing equipment on, and which group, and in those protocols, which particular patients are they going to continue to rely on our public health laboratory. And then finally, whether or not, I'm sure they will, but which patients will they send results to commercial labs, knowing the commercial labs are taking 4 or 5 days to get results back to the ordering physician here in Monterey County. The total testing is, as I mentioned, is a little over 3,000 so far. Over the next month, once we start our testing here in Monterey County, I believe we're going to have, my calculations, based on what Elsa said, which was Elsa, that was 123 up to 103 tests per day per site, correct?
Per site.
I believe that's what she said.
Yeah. So if we maximize our testing in the span of 4 weeks, or we could have about 7,000 additional people tested. And so that's, and right now we've had 3. We'll continue to test, so our numbers will go up too in our laboratories. But that's in 4 weeks, that's a big jump from what we've got now. But that will still get us to over 10,000 tests. But we have 450,000 people in the county, so we really do need more testing capacity. But at least that testing is going to inform us in terms of who's positive that might not have been identified as positive until now, and we can get more people who are positive into isolation to further slow the spread of the virus. Because right now people aren't getting tested, but they're positive, and they're going about their business, and they're probably exposing people. So this will be a tremendous help for us.
Thank you. And here's a question regarding beaches. Santa Cruz County has limited beach activity to no activity on the sand between 11 a.m. and 5 p.m. What is the latest on beach rules in Monterey County? And there are some differences between Monterey and Santa Cruz County in beaches.
I'll jump in a little bit. I don't know if Dr. Moreno has any additional, but excuse me. The beaches are run either by the state or by the cities in Monterey County. So there are rules that they're each trying to set up. My understanding is that, for example, the city of Monterey has some restrictions similar to Santa Cruz, not identical, but it's under their jurisdiction as far as how they're going to allow access to the beaches and access to the water. My understanding is that most are imposing similar restrictions to what you might find in large open space areas, where you're allowed to use them as long as there's no congregation among the people using them. And you're also allowed to traverse the beach to get to the water, for example, to do water sports, again, in a way that allows for physical or social distancing.
And
Thank you.
I'll just add that the health officer order, the health officer order does not order any beaches or parks to be closed. That still lies, for now, at the discretion of the agency that runs the beach or the park. My order does encourage people to get out and be physically active and run, walk, run, bike, cycle in our parks, the parks that remain open, on trails, in our community. But the face covering order has guidance and requirements for how those individuals can still cover their face to protect, to guard against spreading the virus.
Thank you. And Dr. Moreno, how does the Public Health Department or your office define essential?
Potential.
I'm sorry, essential.
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 Right. So the health officer order describes what is essential. There's essential activities, and under essential activities, there's essential businesses, essential infrastructure, businesses, government, infrastructure, healthcare. There's a variety of essential sectors that are included in essential activities. Well, the purpose of that is to, and they're described in there. So the purpose there in the first order was to again identify what is the minimum level of support of service that needs to be provided in Monterey County until we were able to get some information through testing and observation of what is happening with this virus in Monterey County. And the other thing is having just essential services actually bought us some time because our hospitals were still in the process of the planning and implementation phase of increasing their hospital bed capacity. And so everyone who cooperated with the shelter-in-place order contributed to getting our hospitals extra time to set up what we need, and it's still buying us some time as we are working with the private sector to stand up an alternative care site in the event that we have a surge that overwhelms our local hospitals.
Thank you. And will golf course operators be able to accept reservations from people outside of the county?
No. Let me get back to you, May, on that one, okay? Let me get back to you on that one.
All right. And here's your next question. How did you determine which businesses or activities should be allowed to reopen? Also, what would you say to people who worry the economic fallout will be more devastating than the virus?
So the first question, I'm sorry, the first question again, Maya?
How do you determine which businesses and activities should be allowed to reopen? You muted yourself.
What I'm looking at is really looking at the data that we have to make sure that our community could bear the impact of some increased transmission or exposure to the virus. And so I think now at this time we can, and the selection of businesses is looking, or the way of looking at it is trying to achieve through incremental releases of restrictions, release of restrictions that result in maximum benefit to the community, both either that be socially, emotionally, or economically, or provide a resource that we need moving forward. So those are, and then I also have had ongoing weekly communications with other health officers in California and with the state health officer and our state secretary of health, and in these discussions to arrive at as much consensus as we can, at least in our region, and accepting that there will be differences from the state action and differences from other regions or other counties, but for the most part, trying to get as much consensus on what type of activities will be allowed.
And the second part of that question was, what would you say to people who worry the economic fallout will be more devastating than the virus?
So the virus is definitely unchecked, would have a significant impact on our lives, and as a result, economic impact. But the restrictions also have an impact. So what we want to do is arrive at a balance of trying to minimize the impacts of the virus and trying to minimize the impact on our society through shelter in place and social distancing. So we haven't, at least in my career, we haven't done this before. And most of my colleagues haven't done this either, and I don't think state health officer has either. And most business owners haven't gone through this before with shelter in place. We went through H1N1 without sheltering in place. So this is completely different, which means that we're in an ongoing learning mode. And in order to learn as much as we can, we have to have data. And so again, that's why the testing is critical. If our universities can update the formulas that they put in their modeling to better reflect what we've been able to achieve here in Monterey County through social distancing, the output of those models should hopefully soon better estimate what the impact might be on our community and on our hospital system.
Thank you. And what about guidance perhaps on gardening and landscaping, which has changed in this order? And also, when will the construction appendices and guidance be available?
So I wish I could have released all the appendices this morning, and but I'm also trying to get information out to our businesses so as early as possible. So I think it's important to get the order out and get the appendices out as soon as we can. And in terms of gardening, thank you for, I'm sorry, whoever asked that. That was one of the changes that I failed to mention. We're including, or I'm adding plant nurseries and gardening without restrictions back on the list of services that are permitted. There is no appendix for that part for those businesses. And so previous to this, the nurseries had limited function and the gardeners could not garden for cosmetic reasons. So now the nurseries are open and our gardeners can now come back and get to work, and there's no restriction on the type of gardening or landscaping that they can do.
And could you give examples of which, sorry, this question may not be necessarily for Dr. Moreno, but Elsa Jimenez, if you are still on the line, can you give examples of which groups of people will be getting tests at the new test sites that have been announced?
Yes, definitely. That's a great question. I mean, one of the primary goals of the testing task force is to really expand the availability of testing across California. And as Dr. Moreno alluded to earlier, by expanding testing, we'll be able to protect our more vulnerable groups and really gives us a better understanding of the extent of the spread of COVID-19 in our communities. So with that, the California Department of Public Health has issued new guidance on April 19th that they'll continue to study with respect to who the priority populations are for the testing. So in priority 1, are in hospitalized patients, symptomatic healthcare workers, and persons identified for testing by local public health contact investigations and disease control activities in high-risk settings. Priority 2 is screening of asymptomatic residents of congregate living facilities prior to admission or readmission, screening of asymptomatic healthcare workers, symptomatic persons in essential health and public safety occupations, and symptomatic persons over 65 years of age or with chronic health conditions. So now we start to see asymptomatic first responders, healthcare workers and individuals living in congregate living facility are included as a priority here, whereas with the Centers for Disease Control, they're not necessarily included as a priority. Priority 3 would be symptomatic persons in essential infrastructure occupations. So these would be our frontline workers, grocery clerks, agricultural workers, utility workers, some of the workers in the new and expanded sectors that will be able to get back to work. And then CDPH also created a fourth priority, which is community-based testing for all low-risk symptomatic persons, and then surveillance testing of asymptomatic persons. So definitely broader sector of our community will be able to be tested for COVID-19, and that is really one of the goals of the task force, is to make testing more available in California, to be able to test more individuals so that we can really have a better understanding of the spread of COVID-19 in our state.
And Elsa, a question just popped up about referrals to this testing site. I think this testing site is a little bit different. You might want to address that while you're talking about it.
Sure, definitely. There will not be a need for a referral. What the state has done is that they have a standing order for anybody that would like to be tested. So we do not need to have your local primary care provider provide a referral or an order for the testing. There is a standing order provided at the state. And what we hope to do, as was stated in the press release yesterday, is really get in our healthcare workers, our first responders, whether they're symptomatic or asymptomatic, in for screening initially, then open it up to other asymptomatic essential workers, frontline staff, grocery clerks, ag workers, etc. And then hopefully by the third week, be able to open it up to members from the public who meet these are within these 4 priority groups to be able to sign up. My understanding is that part of the screening process is that they will ask for you to identify who you are in terms of your fitting in any of these 4 priority groups. But again, we're still finalizing the details with Optum. As you can imagine, this was announced last week, and all 80 sites are working with the state and with the vendor to get all of these up and running by Monday. And there's been a few that have already started up in other parts of the state. And so we're just doing the best that we can to try to get all the information so that we can let the public know.
Thank you, Elsa. And I've got a question here about enforcement, and I'm hoping that Charles McKee will be able to step in and answer possibly part of this. We don't have anyone from the Sheriff's Office on the line, but the question is, people are ignoring many of the guidances and recommendations, such as social distancing, masks, activities, and business operations. What is being done to step up enforcement so that people are less likely to ignore health recommendations? And would they actually extend to citations or jail time?
Thank you, Maya. Those are definitely important questions and issues surrounding the order. I think that it should be recognized that there's been quite a high rate of compliance. There are a lot of people out there wearing face coverings. There are a lot of businesses that are putting in their own rules about face coverings and distancing, physical distancing, if you're going to frequent their business. And those kinds of practices, we think, will become more commonplace, such that the community is going to feel that it is more easily to adapt to making sure that we're following these kinds of good practices and rules. And I think that the more we have show good progress, the more likely we're going to continue having good compliance. If we have bad progress on our numbers, if they start increasing significantly, I think there will be more pressure on people to follow those kinds of good practices and protocols that are out there. I know that there are several industries that I think were led, particularly by the grocery store industries and the agricultural industry, to have protocols and practices in place to address this exact situation. And part of that is education. A big piece of any compliance type of situation is education. And we've partnered with the 4 hospitals in the county to put healthcare workers in the fields for the agricultural industry to get education to the workforce and to get them to recognize exactly the seriousness of the issue and to have the kind of the spread of compliance as opposed to spread of the virus be a success. And I think we've done a great job there. There's always going to be some outliers and some people who either refuse or just aren't really cognizant of the need to be prepared in this way. And we're gonna keep pushing out on them. As far as actual law enforcement, they are going out, they are talking to businesses, and that's being done, I guess I should say enforcement, it's not always law enforcement. That's being done by, different parts of the county, including some help from the Environmental Health Bureau of the Health Department. And then as we ease restrictions and allow more construction and those kinds of activities, we will be getting the cooperation from the building inspectors of the cities and the county to help enforce the rules as have been laid out under the shelter-in-place, new shelter-in-place order. And then finally, as I was trying to say, that the police and the sheriff are going out, they are talking to people, they are trying to get compliance. We certainly don't want to have a surge of arrests such that we have a surge of additional inmates in the jail. We don't want to potentially bring COVID-19 into the jail, but that doesn't mean that we won't have law enforcement if people flout this order. So it's going to be a multi-pronged approach. Education is the first step.
Thank you, Charles. I know we're just about at the end of our hour, but I'm going to try to squeeze in one more question. And this, I think, is for Dr. Moreno. When testing people to determine if they are positive for COVID-19, individuals are being asked about their age, gender, region, and clinical information. I'd like to know if data will be retrieved to determine what their occupation is to be able to trace vulnerable populations.
So certainly, so the state of California requires that healthcare providers collect the occupation of their patient that they're reporting to us with COVID-19. Sometimes the provider includes that information, sometimes they don't. So what we do is our disease investigators will then, when they talk with the patient who has COVID-19 or the family member of the patient who has COVID-19, they are asking what the patient's occupation is. That is basically whatever the person says. And so we have literally hundreds of different type of responses that patients in Monterey County could provide us. And so what we attempt to do is, what we're trying to do is categorize as best we can all those responses. So that's one thing that our epidemiologists are also working on, again, because it's not, they just can't run a report and that we can share with the public. We have to work with that data. And so that work is in addition to the other work that our epidemiologists are doing as well. So we'd like to see if we can make that work sometime in the future.
Thank you, Dr. Moreno. And with that, our hour is up. I see some additional questions have come in, and I will forward the questions that have come in for response. Thank you very much for joining us. Our next media briefing will be on Monday, and we'll see you then.